Good morning. It's good to see you here this morning. I am Margaret Latimer, the Vice President and Provost for the Germantown campus and for the college-wide STEM unit. It is my great pleasure to welcome you to the first Frank Islam Athenaeum Symposium of the 2022-2023 academic year. This is the 12th year, I think, that the college has offered that the Germantown campus has hosted this series. If you are new to Montgomery College and to the Athenaeum, I'm very pleased that you have discovered this speaker series and are able to join us this morning. And a very warm welcome, of course, to our speaker, Dr. Devlon Jackson. An Athenaeum is an institution or a place for the promotion of inquiry and learning. We have learned that the virtual space can be a very effective place, but it is wonderful to be here in person today, to see all of you, to see faces, even if they are masked. The eponymous speaker series is made possible by a generous gift from Mr. Frank Islam. If you don't know his story, one of remarkable immigrant success, I encourage you to go to the college website, search on Athenaeum, and you'll find that there's a video. Watch that video. As I said, it's quite a tale. Mr. Islam is a champion for democracy and therefore of ideas and knowledge, and committed to the philosophy that if you can conceive it, you believe it, you can achieve it. The exploration and understanding of issues, such as this year's theme of social justice, community wellness, are vital if we are to address the challenges that we face locally and globally. It is through our shared understanding of these issues that we can conceive a shared vision of shared goals and work to achieve those goals. The imperative embedded in this year's theme, social justice, community wellness, have been brought to light by the pandemic. It was not news, however, that some populations, which can be defined by race, income, place, and other factors, are disproportionately vulnerable, bear a disproportionate share of the burden of disease. I think you will find today's talk relevant, important, and fascinating. I want to thank Dr. Fiona Glade, Dean of English Language for Academic Purposes, Linguistics, and Communication Studies, Professor Katima Lee, Professor Amanda Miller, one of our Athenaeum faculty fellows, Ms. Vivian Chang, Peter Pereira, our wonderful MCTV support, and of course our amazing IT team for their support. I would like to invite our own remarkable colleague, Professor Katima Lee from the Germantown English Department, to introduce today's remarkable speaker. Following her talk, following Dr. Jackson's talk, at approximately 12:05, Dr. Glade will moderate the Q&A, so hold those questions. The symposium will conclude by 12:30. If you do need to leave, and we know that some of you may have a noon class, please slip out quietly. Thank you, and again, welcome.
Good morning. Today we are very fortunate to have Dr. Devlon Jackson here with us, who will deliver a presentation titled Digital Health, Connected and Disconnected with Communities of Color. Dr. Jackson is a health communication scientist. With a health equity lens, Dr. Jackson examines how mental health impacts physical wellness, addressing communication inequities contributing to access and use. Dr. Jackson values the need for a more comprehensive health approach when communicating health information, especially if our nation hopes to eliminate health disparities and achieve health equity. She was awarded 2 fascinating and important research grants, the NIH Investigator Diversity Research Supplement Grant to explore how health information technology can improve health for African Americans and Hispanics living with mental health issues and chronic disease, and she was the project director for an NIH National Library of Medicine project titled Healthy Me, Me Salud, Smartphone Applications, this is a mouthful, identifying mechanisms to engage African Americans and Hispanics in Personal Health and Health Libraries. She was awarded an honor for outstanding research presentation for implications of social media use on health information technology use. Dr. Jackson currently serves as an assistant research professor in the School of Public Health's Department of Behavioral and Community Health at the University of Maryland. She is also a faculty affiliate with the Maryland Center for Health Equity and the Hurwitz Center for Health Literacy. Montgomery College community, please welcome Dr. Devlon Jackson.
Good morning. It is truly an honor and a pleasure to have the opportunity to come and engage with you and speak with you about an area that I'm very passionate about. And that area, as you can see here, is digital health. And I find it really fascinating and important because technology, as we are continually to see, isn't going to go anywhere anytime soon, most likely, right? It's just continuously evolving and so forth. However, all of the excitement and all of the amazing things that it can do as it relates to our health, there are inequities that exist that have still not made it inclusive for all communities that could benefit from it. So today I'm going to talk about how digital health is connected to our communities of color, but also how there's some disconnections. And then we're going to discuss a little bit about some solutions that I think social scholarly activists and policymakers and developers and those that are doing this work should consider. And even if you're not in this area, but you, of course, you manage your health, right? Whether it is in conversations with your family and or your friends or the things that your healthcare providers share with you, hopefully this will give you some insight on how you might approach using digital health tools in your own personal life. So before we get started, one more thing that I just wanted to share with you is that when I'm referring to the term communities of color, for the purpose of this presentation, I am speaking primarily about Black and African American community members, Latino, Latinx, or Hispanic community members and Asian community members, primarily because those are the communities that I've had the opportunity to work with. But of course, I hope that I will have the opportunity to work with others as I continue my work. So, I want to share with you how my personal experiences played a role in me moving in this direction of digital health. And so I'm going to first go all the way back to kind of a little bit of my family tree and how that happened. So this here is a photo of a small town in Northwest Florida called Vernon, and it is in Washington County. And the population is about 750 individuals as of the most recent US Census report. And this is the hometown of my father and my grandparents. And so and it's considered a rural town. That stoplight there is the only stoplight that they have, okay? And so when I would go visit, my brother and I, we would joke and tease, and we would send out PSAs, even up into our adulthood, public service announcements, on text messages and emails to friends and colleagues. If we're delayed in our response, bear with us because we're in the country right now and completely disconnected. And we really were. And so when we would go there, my grandmother, sometimes I would nudge her and say, well, don't you think you should get the internet or hotspot or broadband or Wi-Fi? And she's like, I don't need that. And she didn't see value and importance of that. And I respected that because she felt that if she needed to reach out to someone, she'll just pick up the phone or she'll get in her little Buick and she'll drive and go see that friend, family member, or colleague or healthcare provider. Same with my grandfather. And so this is a photo of them. In that time with that disconnection, what I thought was disconnection, they were actually connected. But I did feel that, well, they're still kind of disconnected to what I felt was the outside world with technology. But my father would say, oh, just relax, enjoy being in the nature and isolated and from all the distractions of the world. But even in his life experiences with technology, him traveling all over the world when he was in the military and working in various fields within Florida and other parts of the country, he was considered a late adopter to technology. He felt that his flip phone was just enough. My brother and I, we would tease him and say, so when are you going to join us in 2020 or 2000? And he eventually did. But even when he did, he said, I don't need all the bells and the whistles. I'm good. If you all need to reach me, you can find me. And we always did. But still, we just wondered, okay, fine. That was his preference. So he showed us how he was connected and disconnected. So that was my father's side. Now on to my mother's side. This is a picture of Riviera Beach, Florida. If anyone is familiar, it is in South Florida. It is right above Fort Lauderdale and Miami, Florida. And so that was a completely different experience going and visiting those grandparents, because in that household, my grandfather here on the right, till to this day, at the age of 89, he is on top of all the latest technology. He can tell you the latest cell phones, the latest televisions, computers, laptops, everything you need. And so he was always making sure that my brother and I had access to whatever as it related to laptops and technology for our education. Whereas although my grandmother felt the same way, she wanted to make sure that her grandbabies had access to all of those things, she was not interested in having access to those things at all. She, as a retired registered nurse and public health nurse, was not interested in the tablets, the smartphones, the patient portals to communicate with her providers, to engage with, even with her family members. When we were trying to reach her, she always had her cell phone off. And I'd be like, Grandma, how are we supposed to reach you? Call the landline. And so those were those moments where I said, okay, this is really interesting. These two individuals in the same household, they see the big picture and the value of technology, either for general purposes or for health purposes, but within their unit, there is a disconnection as it relates to technology. And so with my mother, their daughter, I saw several different examples of the connection and disconnection of technology there in general uses as well as health uses. So for the general purposes, when I was younger, I remember growing up in Tallahassee, Florida, because that's where I'm born and raised. My mother was a part of an initiative working at Florida State University where she helped to design and implement a program for underserved, lower income youth of color that needed access to computers. Now, this is back when I was much younger, like in the mid 80s. And during that time in the 80s, internet wasn't really a focus. It was more computers. That was the excitement, right? And so being able to connect communities who didn't have that access, even at that young age, I was kind of amazed that there was this mobile van that they would drive around with these computers that provided opportunities for students to do homework and to get tutor services. And I was like, wow. But still in that moment, even in my awe, I didn't think that this is where I was going to end up as far as my career. And so other things that I observed with my mom and technology was in present day. She currently is a psychotherapist, and she uses telehealth often to engage with her clients. When COVID and the pandemic happened, she was still able to connect with her clients. And so she saw the value of it, still sees the value of it. But she has also shared with me, because of the work that I do, that some of her clients, once the policies and the regulations started to lighten a little bit, that they wanted to see her face to face. They didn't want to only remain online. And so she has adjusted for that. So then I started to dig a little more and I asked her, I said, how do you feel personally about technology? You're using telehealth. How do you feel about electronic records? And the reason why I asked her specifically was because she is a survivor as we like to call her, of two rare health conditions, sarcoidosis and trigeminal neuralgia. And those two health conditions, for many years, it took a long time for healthcare providers to figure out how to help her manage them in a way that she could function daily. And so she still has to be very much engaged with her healthcare provider regarding her treatment plan. And so I asked her, so how do you feel about, exchanging health information and engaging with them through these patient portals and electronic health records? And she said, well, I find it useful and convenient because I can just log in and see my information. But because of the history and of being a woman of color in and out of the hospital for my conditions and experiencing some, racial and racism and oppression in some interactions that I even observed as a young child with her healthcare providers, she is a little cautious about, well, who has access to this information? Where's this information going? Who is sharing this information? So she is cautious about what she shares online versus what she shares with her providers face to face. And so in all of these experiences, observing my father, my grandparents, my mother, one might say, oh, well, maybe that was just enough as your foundation for your work. Well, I experienced what I felt was more of a jolt to disconnection and connection in technology in my first year of college at the University of Central Florida. So because you have my grandfather here, who's considered the expert in the family of all the technology, he made sure that his granddaughter had the latest computer and was ready to go. So when I got on campus, I thought, I'm ready to go and I have everything I need. Well, I found out in those dorms at that time, if you wanted internet service, you as the student had to purchase that internet service to be connected. Interesting, right? And so that's already a disconnect. Well, at the time I was like, okay, well, maybe I'll just call my parents. Well, I didn't feel comfortable calling my parents at the time because, as I mentioned earlier, my mother was struggling for many years with sarcoidosis and trigeminal neuralgia. And at that time, the doctors didn't really know much. They had her doing many different treatments that even led to her having to have brain surgery. Of course, as you can see today, she is all is well, thankfully. But in that time, when she was undergoing those major surgeries and in and out of the hospital, what do you think happened? She became unemployed. When she became unemployed, we didn't have the resources that we initially had. And I had apprehension about asking her for, or anyone in my family, hey, can someone help me get connected? I had apprehension because I was thinking, internet, that's maybe a luxury and a privilege rather than a right. And so at that time, thankfully, I had roommates that they let me share their internet passcode. So that's how I was able to stay connected, thankfully. But I know that that wasn't the experience for everyone. So I say all of this to say that my experiences personally with my family and with myself, I've seen a lot of ways in which we've been connected, but I also have seen the ways in which we've been disconnected. And so whether disconnected or connected, this is a part of my lived experience as a woman of color. And so my experiences with connections and disconnections with technology in general serve as the foundation for the work that I do today and was launched officially during my postdoctoral training. So prior to my postdoc at the National Cancer Institute in the National Institutes of Health, specifically in the Health Communication and Informatics Research Branch, I know that's a mouthful, my primary focus in my doctoral training was patient-provider communication, specifically looking at how Black men and their providers discuss treatment options for prostate cancer. And so I focused on that because I knew the value and the benefit that when there's effective patient-provider communication, it can lead to positive health outcomes. But when I began my postdoc, I knew I wanted to further explore how patient-provider communication could be enhanced for our Black community members, as well as many other communities of color. And so one of the areas in particular that I wanted to explore was how digital health tools could play a role in enhancing the patient-provider interaction. And so during this training period, I realized that I shouldn't just limit myself to how digital health can be useful for communities of color in the clinical space. Why? Because we don't live in a bubble. We don't spend all of our time with our healthcare providers. We get health information outside of the clinical settings, right? We get it from our family members, from our friends, from the internet, from the news, and so forth, and on and on and on. And it occurs at so many different levels. And so I said, you know what, we need to, or I want to explore digital health, not only just in the clinical setting, but also how it can benefit us outside of the clinical setting. And so with that, as much as I was excited about, oh, look at all the possibilities of how digital health can help and contribute to eliminating health disparities and achieving health equity, I recognize that I needed to be actively working to find solutions to address the persisting disparities and inequities and disconnections that still are present in digital health that are contributing to these health disparities or exacerbating some of these health disparities. Not the total issue, but a part of the issue. But before I go forward, I do want to define what I mean by digital health. Does anyone know what I mean when I say digital health? Just a show of hands. Okay, kinda. All right. Okay, no problem. That's what I'm here for. So what is digital health? Well, the primary definition is it's the use of information technologies to prevent and manage health conditions and illnesses. So what are those different examples of digital health tools? Well, first, we have our smartphone apps. That's digital health. So when you use an app to meditate, to monitor your diet or your nutrition and how you're eating, like MyFitnessPal or Calm for your mental health purposes, or when you're logging on and you want to look for a particular provider and be able to talk to them over your phone using that mobile app, that is digital health. It is also wearables. I'm wearing one today. It's that photo right there, an Oura Ring, or smartphone watches. Anyone have a smartphone watch or a Fitbit in the room? Okay, I see a few show of hands. That is digital health. Those things, and like right now, this ring is monitoring my heart rate, it's monitoring my steps, it monitors my sleep, and so forth. That's a form of digital health. Another example right here is electronic health record system. Electronic health record system is all of the records that you have as it relates to your primary healthcare provider, your specialists, your mental health care providers, and those health records can be exchanged between other providers in healthcare systems. But we'll talk in a moment that not everyone has that system in place. With those electronic health records, you as a patient or as a consumer can log into what we see here is a patient portal. Does anyone have a patient portal and use their patient portals? Okay, good round of hands, all right. Well, for those of you who have not explored it, maybe consider. So this patient portal here, as you can see, for some, you can access it through your phone, or you can access it through your laptop, or both. Right? And so when you log in, you can see your records, you can see notes that your doctor has made to you about your visit recently. You can see lab results, you can see prescriptions, you can even do a prescription rather than calling the pharmacist or calling the doctor's office and saying, hey, I need a prescription for whatever medication that is. And then this last example is what we saw a huge increase of, which is telehealth. Right? And so telehealth it allows us to be able to see and visit or hear our providers virtually. So no matter where we are in the world, we essentially could have our medical visit through a telehealth. So now that we understand what digital health is and these examples of them, we saw a great deal of increase in these tools during the recent pandemic because people were home, people were isolated, and so they were finding ways to stay connected and be able to have access to healthcare resources, services, and we saw some really interesting things as it relates to connections within our communities of color. So first, one thing that we saw was with telehealth, as we saw in the news. I mean, it was major, right? It went from 3 years ago, telehealth use was less than 30%, and it has increased overall to about, I think, around like 75%, which is major. However, you'll see in a moment that there are some differences as it relates to race and ethnicity. But we did see some improvements that with smartphones, because according to the Pew Research Institute studies, Black and Hispanic community members, as well as Asian community members, are high users and owners of smartphone devices. So if they don't have a laptop or computer, smartphone devices have been a great way for them to get connected to internet, general services, as well as health services. So we saw an increase in telehealth because of their access to smartphones. We also saw that with telehealth, it contributed to a decrease in no-show medical appointments among Black adults. A study in the Philadelphia healthcare system revealed that the show rate for medical visits for Black adults went from 52% to 70% because of being able to have access to telehealth. So that was probably contributed to maybe there were some transportation challenges, right? Or maybe some other challenges or barriers that were preventing them from being able to show up. Or maybe it was their job and their schedule. And so now I can just log in wherever I am at the convenience of my phone. So that was awesome. Another thing that we saw in connection was with our Hispanic, Latina, and X community members. They were reported to be the most engaged in comparison to other racial and ethnic groups for telehealth, specifically for mental health care. That is powerful and so key because we know, according to studies done by the American Psychological Association, that Hispanic community members and Black community members are disproportionately impacted as it relates to psychological distress and mental illness compared to their white counterparts. We also saw that our Hispanic and Black adults were and are avid users of mobile health applications. So all those examples that I mentioned earlier of using mobile health apps and so forth for either meditation or tracking diet or communicating with a provider, these community members are using their smartphones and leveraging that to be able to stay connected with health information and compared to other racial ethnic groups. And I've seen this in some of my own work with my collaborators at the University of Maryland, where Dr. Cynthia Bauer serves as the principal investigator of this particular award. As mentioned earlier, the Healthy Mimi Salud smartphone. So this was a smartphone that we worked with Black and Hispanic community members in the state of Maryland to design. And it was such an enriching and wonderful experience because I think that is how we should be developing these digital tools. We should be working with community members, but I'll talk more about that in a moment. And so we worked together to determine what were their preferences, what would they like to see, what are some sociocultural factors that we need to keep in mind. And in the whole purpose of this research project was, after it was designed, we wanted to be able to test and see if, when these community members are receiving personalized health information at their fingertips at any time of the day, does it increase their health information seeking, which then does it also lead to achieving health goals like healthier eating, exercising, managing stress, getting certain screening tests like for cancer or vaccinations. And what we found was that participants reported an increase in health information seeking. We saw that in our quantitative data as well as in our qualitative interviews or post questionnaires and interviews. They reported and said that, we found this to be a very useful tool. Not only did we find it useful because, wow, I didn't realize that this was something that was available for me, but also they were exposed to different information resources that they didn't realize was available for them. Another big important thing with this study, which I'll expand upon, talk more about the importance of, was that one of the initial reasons why we wanted to do this study was that we learned that a lot of these mobile apps are primarily English-based, and they don't consider many other languages of our communities of color. And so this was an opportunity for us to create an app with our Hispanic, bilingual, and Spanish-speaking community members and see how they enjoyed it, what did they like, and what did they dislike. And so they did share with us in the initial positive preliminary findings that it was useful for them. And so, although there are many connections, we have to consider that there are disconnections within these communities. Now, some of these findings that I'm about to share with you, you might say, well, wait a minute, that kind of contradicts the other findings that you just pointed out. And I'm going to share with you in the next slide why there are some contradictions, and it's because of some factors that are not being taken into consideration. So first, telehealth use is inconsistent among Black and Hispanic households, despite overall increased use across the general population. We also have seen that Black adults are least engaged in telehealth for mental health, although their Hispanic community members or peers are using it for mental health. We notice that older Black adults are less likely to use video for telehealth. And the reason being is because many of these consumers don't have smartphones that allow for that video use. Many of them have the traditional flip or non-smartphone devices. We also notice that our Asian adult community members have reported to be least engaged in telehealth and other digital health tools during the pandemic in general. Some of the reasons involved that, not only just before I get to the reasons, we noticed in this particular study that was conducted by another team of scholars that they had low percents of combined telehealth and in-person before COVID, and it remained low even during COVID. This was a really concerning finding because they saw that in those neighborhoods, many of those neighborhoods had high COVID rates. And with those high COVID rates, for some reason, there was a disconnection for those communities to be able to access technology. What those scholars who did this study assumed was because many of those Asian community members that were residing in those communities that had higher rates of COVID, they were also in communities that had been redlined regarding technology. So those areas were not, technology had not been implemented in those spaces. So it made it difficult for them to be able to use and connect to their providers, and possibly also exacerbating their COVID risk. Another finding was that in disconnection, and another study was that wearable devices inaccurately have been detecting biomarkers such as heart rate among consumers with darker melanin or skin tone. So I don't know if many of you are aware, but some of our wearables that have these sensors, they have not all of them include the more expensive sensors that consider darker melanin or skin tone or even tanned skin. So something to consider. And then another thing is that many digital health tools do not consider or include, as I mentioned before, different language options beyond English. Something that we learned recently in a study, and we're trying to figure out, a study that we're proposing in the near future, is how can we incorporate electronic health record systems or patient portals in interventions and initiatives for individuals that don't speak English. If many of these systems are primarily only English, there's only a few that have Spanish language, and most of them don't consider Asian languages at all. I've seen this disconnection in my study that was mentioned earlier, where I was funded by the NIMHD, National Institutes for Minority Health Disparities, where I'm still collecting this data. But one of the aims in that study was to assess the perspectives and experiences of primary care providers and patients for telehealth use, specifically for mental health and primary health care. And so far what we found, unfortunately, and these are still in the early stages, is that initial implementation among providers was very challenging. It was challenging because not everyone was ready to provide telehealth during COVID, as well as not everyone was trained to provide it. So that's what I'm going to talk about more about. It's not even just at the consumer level. There are things that we need to consider at the provider level regarding this. There is mixed enthusiasm for engagement based on cultural factors, such as privacy concerns, talking about mental health issues over telehealth, but maybe I'm at home and I am sharing my home with other family members that might be able to overhear some of the things that I'm not ready for them to be made aware of. There are also cultural concerns as it relates to privacy issues, similar to what I noted that my mother shared as far as who has access to this information, how is this information being used. So as I continue to explore the disconnects and inequities in digital health, I am understanding what scholarly activists and social justice individuals like Reverend Dr. Martin Luther King Jr. stated and Angela Davis in this quote right here from Dr. King: "Of all the forms of inequality, injustice of health is the most shocking and the most inhumane." This is so relevant to my work because we have to consider how, as these tools are being developed, not everyone is able to connect due to systemic oppression and issues that contribute to access and use. So when Angela Davis here in this quote states that importance of conceptualizing the social justice struggles of communities, this is also relevant because the only way we can address the disconnections in digital health among communities of color is if we imagine these communities and their experiences as our experiences as well. If we don't do that, it's going to be difficult for us to really get at the inequities, really get at the injustices, if we don't view them as equal partners in this social justice and this work. So we have to look at this as we and not as them, and remove this othering language so that we can really move to some true solutions in the digital health space. So, what are some reasons for this disconnection when we think about social justice and the inequities? Well, the reasons are a part of the systemic oppression, systemic racism, systemic bias and prejudices that many of our communities of color have experienced. We've seen it, as I mentioned before, in redlining examples, where in lower income, which oftentimes has many of our community of color members there, have intentionally been redlined and not implementing those technologies. Why is that important? Because that allows me to have access to telehealth. It allows me to use my mobile phone. It allows me to use certain mobile apps easily. We have seen it in economic inequities. Our Black and our Hispanic community members are significantly behind in the wealth gap compared to their white community members, according to various studies, including one that was recently done by the Brookings Institute. White average household incomes can get up to 1.2 million, whereas Hispanic and Black household incomes, in comparison to that, are less than a third. So around 250,000 average income. That is a significant gap. And why is that important? Because that allows access to technologies that can be very costly. Those technologies that I posted, like digital health apps, and some of those require subscriptions, or Ring smartphones. Those are costly, as well as being able to have a data plan that allows me to have unlimited data to constantly talk with my provider over a video. Absence of technology. So as I mentioned before, we saw some inequities as it related to older adults being less likely to use video for technology. Well, one of the reasons, as I mentioned before, is because maybe for some people, their phone only allows them to be able to hear. Well, we miss out on things when you can only hear in a healthcare visit. You can't see certain things. You can't see certain elements or conditions that could provide a better diagnosis or better next steps on whether that person should be coming in or not. And what if this person is having challenges of being able to come in to see them? We also have seen reasons for disconnect in limited considerations of the role of intersectionality. We have learned that intersectionality, especially when it comes to our communities of color, is so important. We can't only just look at their race and their ethnicity, because when other factors are intersected with their race and ethnicity, oftentimes if those factors are not addressed, their health outcomes are worsened. We've seen that with our Black and LGBTQ plus community members, our Hispanic and LGBTQ plus communities, as well as communities of color in general for LGBTQ plus, because there are certain devices or telehealth or digital health tools that don't account for gender identity, don't account for how sexual orientation plays a role in their health preferences or health needs. We've seen issues and challenges as it relates to being a community of color and a member of the community of color and living in the rural area. But I just gave you an example that you could be in the urban city area and still be issues being exacerbated because of your race and other factors. We've also seen with digital health literacy. So one of the reasons for disconnections is digital health literacy is the ability to be able to use tools in a certain way, right? To be able to understand what certain functions mean, what certain tools mean, how to slide here, slide this. How many of you, when you started to use Zoom for COVID-19, was it an easy transition? Okay. It wasn't for me either, and this is my space. And so if it was a challenge for you all, imagine those that still it's a challenge for, right? And one of the things that I thought was really great during this time was that some of our community members discussed how our study with the smartphone health app actually helped to lower some of that apprehension, and I'll talk more about that in a moment. And then, as I mentioned as well, language preferences, so I won't repeat myself there. And then I talked a little bit, as I noted, about privacy concerns. Where is this data going? When we think about our communities of color, in 2 studies that I have worked on and am working on, our Asian community members have expressed to us, as well as our Hispanic community members, concerns about, if I enter my information in this digital platform, is it going to put me at risk for immigration issues? And so when we're thinking that, oh, but this is for your health outcomes, they're thinking about other things as well that we should also be taking into consideration when we think about privacy concerns. So how do we move forward? So first thing I want to offer is that we should invite community members to be a part of the development, design, and implementation process. One of the great things that I appreciated so much in our smartphone health app was that I wasn't sitting up in our offices or up in some tower making decisions and guessing and deciding, oh, this is what we should do, and let's just see if it works. That's the old way of public health initiatives, and that's how we should not be thinking. We should be thinking in all of our work, especially when it comes to digital health, that we should be bringing everyone to the table and asking them what they think. What do they prefer? What do they see are the problems? What do they see are the needs? Because I shared with you, my grandparents and family members, some of them felt that I don't need this technology, I'm good. So understanding that maybe technology isn't always the solution for everyone. In that, when we're inviting individuals to the table, we can consider different approaches like principles of CBPR. If anyone is familiar with this, it's the community-based participatory research. It is encouraging that we bring individuals to the table in every step. So not after you come up with the idea and then say, what do you think? But it's this part of, hey, why don't you be a part of this idea and share with us what you think we should or should not be doing. Also, the culture-centered approach. It's this great approach that was initially developed by a scholar of color, Dr. Mohan Dada, specifically in the field of health communication, where he argues, building off of the community-based participatory research, that we should never start any type of health communication initiative unless we have community members telling us what we should and should not do. And when we are working with them, discussing the structural inequalities that could be a barrier or a challenge to them implementing and or using these tools. Because if you don't consider that, then the tool is not effective or beneficial for them. Also considering and addressing key sociocultural factors that impact digital health use. So I mentioned some issues as it relates to concerns about who has access to my information? How's that being used? Because back in the day, I've heard of these stories as it relates to historical racism and so forth, and how they've used my data without my permission, or they have exploited certain communities of color for different scientific gains. And so we need to consider those concerns. We also should be considering other sociocultural factors like, how does one's faith play a role in their health? And how would we use that in designing digital health tools? How does one's language play a role in that? That's a part of sociocultural factors. Engaging communities of color that are more often overlooked. So one community of color in specific that you didn't hear me mention, but I'm oftentimes advocating for, but have not had the opportunity to work with them yet, is our Native American and Indigenous communities. These are communities that also we should be inviting to the table and asking them, what do they desire? What do they need? Because we know that there are a lot of injustices that these communities have and are still experiencing, especially when we think about specifically with health outcomes and its relationship with technology. And we should consider expanding and creating affordability programs in commercial digital health spaces. We saw that during the pandemic, some of these internet providers created affordability sliding scale programs to make it easier and accessible for families to have access to internet. Why not Apple do that for smartphones? Why not Google do that for different health trackers? Why am I suggesting that? Because many of our communities of color are more likely or disproportionately impacted by health outcomes that are preventable, like heart disease, diabetes, certain cancers, obesity. All of these conditions are preventable through, or many of them are preventable or manageable through healthy eating, exercise, managing stress. What do these digital health tools do? They help with those things, but they're expensive and not everyone has access to them. So let's advocate, I'll continue to advocate, that some of these commercial individuals think differently about how they're marketing their tools to only those that have privilege and access to them. And then recognize that digital health should be viewed as a complement to healthcare, but not a substitute. So as much as I advocate for digital health and see the benefits of it, I do understand and respect that not everyone is interested and or comfortable or wants to. Whether it's for cultural reasons, privacy concern reasons, or a host of others, we should be just making sure that we're letting everyone have access and the opportunity to engage with these tools and create easier ways to get to them rather than creating these barriers so they don't even have an option to see if it's something that they want to engage in or not. And then last but not least, understand that digital health solutions are not only at the consumer and the patient level. So yes, there are things that we need to be mindful of at the consumer and patient level as far as what I carry as a consumer. I'm wearing this wearable as a consumer. I use my smartphone to use mobile health apps. That's the consumer level. But what are we doing at the provider level? Are all of our providers equipped and trained with the proper resources to engage in telehealth or share information with their providers? Do we have policies put in place to ensure that communities are not being redlined when they need access to technologies? Are we ensuring that when we want to share health records with our specialists, because my specialist is in a different network, that their electronic health record system is strong enough or effective enough that that record could actually be shared? That might seem like of course moment, but there are providers that they can't share their records with other providers because they don't have the infrastructure for it. So I say all this to say that it's not just what we need to do at the consumer, it's many different levels that we need to be considering as scholars, as activists, as researchers in this digital health space. So I've shared my personal experiences of being digitally connected, and at a point when I thought I had everything I needed for general technology purposes, I then became disconnected. And these types of experiences that I've experienced, family members have experienced, are oftentimes experiences of our communities of color, like within our Black and Hispanic and Asian communities. And so that brings me to the conclusion of my presentation that I want to first thank you for allowing me to share what I have experienced and learning as a member of the community with other members of the community. And these types of spaces, like this symposium, is so important because it allows us to have these conversations, to share ideas. And even if this is not the space in which you work, it's a great opportunity to be mindful of how this work impacts your everyday living. And I hope that that provided some insight to your everyday health decisions, your everyday health actions, and your everyday health goals. So as we move forward, I hope that this work ignites some ideas as we think about scholarly activism, social injustices, and social justice within our wellness and public health spaces. Thank you so much.
Really like to hear from you about any work that's being done in this area to counter misinformation. I mean, a silly little example, but for me, if I get some tiny symptom, I go to WebMD right away before I talk to my own doctor about it, right? But there are far more egregious ways that people might be misled or abused even through technology. So how do we address that?
Thank you for that question. So some work that we're doing currently is our smartphone app that we developed, the Healthy Mimi Salud app. It actually is, it integrates HealthFinder. HealthFinder.gov is a website that was developed by the federal government to provide health information based on personalized factors such as age, gender, and pregnancy status, as well as tobacco use. And pregnancy status. And so the reason why we use that platform specifically was because we knew that it had been vetted for health literacy principles, making sure that it's in plain language, easily accessible. We also advocated for that resource because we understood that many of that information was accurate and aligned with the United States Preventative Services Task Force guidelines. So that helped to kind of debunk some of the misinformation that individuals, especially that were part of the study, might have been receiving as it related to certain health conditions that they were looking up using the app. We're now also exploring how we might be able to include Medline, which is a resource that was developed by the National Library of Medicine that provides even more health conditions for chronic disease management as well as prevention. And that also utilizes not only certain health literacy principles, but it goes even further as it relates to language. So I know that this isn't related to misinformation, but I think it still is, because we know that I've learned with some of the communities that I've worked with that some information in other languages don't always translate the same depending on who translated that health information. And so one of the great things about Medline is that it provides their resources in many, many, many languages, Asian languages, Hispanic languages, and I think Arabic. I mean, there's so many that I've seen on there. So that is a resource that we are looking at implementing, because HealthFinder only is available in English and Spanish.
Hi, Dr. Jackson.
Hi.
I'm Naja, current student here.
Hi, Naja.
So just a question regarding the Healthy Mi Salud app. I know that you are still in the research phase of it, but being as though you're seeing the benefits and getting that feedback from those communities of color about that personalization of it. Is that something that you all will eventually publicize for us?
Great question, yes. So it will be in Google Play stores as well as in the Apple Store in the next couple of months. We're in the refining stage based on the feedback of things that could be improved by our community members and things that we also noticed as well.
And congrats about that.
Thank you. And it is free, yes.
Oh, that's good. Hi, my name is Denise Dewhurst. I'm a psychology professor here, but I work with a lot of nursing students. And in fact, we spent all last week talking about maternal disparities in healthcare with groups of color, women of color. And so one of the things I'm wondering is, this is great. How is this translating to their training, into the training of medical professionals?
Great question. So the way that I believe digital health could transfer with, you said maternal health and nursing students?
Right, this just happened to be, it's developmental psychology that I'm teaching. A lot of my students are nursing students because it's required for them. So I'm trying to get them to see the connection.
Yes, so definitely first with their interest in psychology, we are seeing increase with telehealth, specifically in the digital health space for these for mental health services. But although we've seen increases with not only telehealth and smartphone apps for mental health concerns or issues within our communities of color, researchers have acknowledged that there isn't consistent engagement. And the consistent engagement, we're still trying to understand why. And so if we have providers that can maybe provide spaces or provide opportunities in explaining to the clients and consumers how these tools might be beneficial and showing what the pros and the cons are. Right. So of course, no, it's not to necessarily say, okay, you should be doing this, but putting back on my patient-provider communication hat days, it's really important that you always provide your patients and your clients with all of their options so that they can make an informed decision. But what oftentimes we see sometimes happen with providers, because they only have so much time, right?
Exactly.
They're providing, say, hey, log into your patient portal, here's a sheet, here's instructions, rather than maybe taking the time to explain how they could use it, maybe even find out, are you comfortable using a tool like this? Do you have any concerns about using a tool like this? Because some of those concerns might be things that a psychologist student that eventually is becoming a therapist, or a nursing student, or a healthcare provider student might be able to address if they were aware of those things.
Right, right. And I just wonder how much they're getting in their training, because, you know, medical school, nursing school, they're so packed with curriculum that this kind of thing, which is really, really important, may get by the wayside. And so then when do they get this? So, you know, I'm looking at it from the other end.
So that's a great question. So, you know, I'm not aware of a lot of schools, and I could be wrong, that digital health is even a course in medical school, because patient-provider communication is just starting to be a course that's being considered in medical schools. So to even add how digital health could play a role when you have current providers who are still trying to wrap their brains around it being implemented in their own practices and going through the trainings. I've even met some providers who said, okay, they've already implemented this new system. Now you're doing updates and you want me to learn another system or another function.
Some of the providers are overwhelmed too. So
yeah. So, and that's why I mentioned that this digital health space isn't just at our consumer level. We have to address all of the issues at multiple levels.
Thank you. No, you've given me a great idea for a new assignment.
Thank you.
Yeah, my student.
Hi, I'm Julia.
Hi, Julia.
I'm a current student here. My question is, this app that you're developing, is it in a way intended to replace current things, not only because they're so hard to use because they're so elaborate? But also, is it to replace something like Zoom, or is it just a patient portal?
Oh, that is a great question. So it won't be used to replace patient portals. It's primarily being used as, or our initial purpose is that it's a mobile health app that I can log in, put in my personalized health information, age, race, ethnicity, family health history, as well as tobacco status and whether I'm pregnant or not, if that applies to me. And then this app, based on the algorithm, is providing or reporting back personalized health information of these various articles that I could save, I could read, and maybe even share with a friend or family member and print out. So it's not serving as a replacement, it's serving more as a complement. And we've even said that this could be a tool, because even in our app, we have a ask your doctor questions function, that it could help to facilitate discussions when talking about, oh, you told me that I'm at risk for diabetes. Well, I saw this article that said this. Can we talk a little more about ways that I might be prevented? Because you said this, and this article also says this. Can we maybe consider that? So we're looking at it as a way to complement, not to replace.
Okay, thank
Great
you.
question.
It's just that you were talking about how you want to reduce misinformation as of a question that was asked earlier, but also make it easier. That's why I got a little confused, that's all.
Oh, sorry about that. And so the easier part, when you're asking easier, are you meaning like how to make it easier to use the app, like digital literacy?
Because you mentioned earlier, kind of through one of your questions, where you kind of gave an example of a doctor being like, go online, do this, do that, all these steps that someone could easily get lost in without someone directing them. And usually doctors don't have time to do that. They'll tell you in your appointment and you're supposed to remember.
Great question. So we haven't started to do work specifically in patient portals yet. That is a study that we're exploring hopefully next year, that our team has been having discussions about in complementing with the app. But specifically to your point about, someone here, go use this, but how do I use it? Well, the ways that we've tried to address that with our smartphone app is that we actually have a built-in tutorial within the app that walks you through every step, as well as a non-print tutorial for those who that would be a preference, that they could have a PDF version of the how-tos. So that's what we're hoping is addressing some of those digital health literacy or digital literacy issues. And we realized that that was necessary because one of our community members that helped to design the app with us almost 3 years ago, African-American male, 76 years old, and he said that he was very nervous even being a part of the study, but he wanted to be a part of it because he said, I'm uncomfortable just using technology in general, but I want to be able to use it not only just for my health purposes, but also to be able to connect with my family members. And he said that when working with us, he said that his apprehension for technology actually lowered because we were walking through, explaining, talking through the steps. But we also shared with him, we learned from him because we learned what we needed to include, what we needed to implement within the smartphone app to make it easier for individuals with various digital literacy levels. Does that help? Does that answer the question?
It does. I also want to thank you for doing something that I didn't even realize was a problem, but it is a tremendous problem, this disconnect between health and just everyone. So thank you.
Thank you. Thank you.